there is a pain benefit that occurs, but as you continue to go up in the dose, that pain benefit is lost. So I've been working with cannabis medically since about 2010.
Which comes back to the need of a holistic approach, right? Where it's not just cannabis as the treatment, but there's other things that your book speaks to as well.
But it's like a rut in the brain. You trained your brain to do this, and now it's time to retrain the brain.
Hello, it's Chad Walkerton from Higher Living, and very, very excited about today, particularly for women out there, because we have an expert in to go into a whole range of topics where it's going to be a real focus around holistic integrative health, utilizing cannabis medicines. And to be able to start bringing it over to you, please introduce yourself to the audience in a way that you want to be introduced.
My name is Michelle Sexton, and I have spent my lifetime with a love of botanical medicine. So I started out by studying herbs. I subsequently became a midwife and a certified herbalist, and then a desire to be able to provide more comprehensive health care to these women and their families. I went to naturopathic medical school. Serendipitously, through that experience, I was able to complete a postdoctoral fellowship in the pharmacology of the endocannabinoid system, which really just opened a huge window into bringing homeostasis and complete whole person health to women with this system as a guide.
Yeah, wow. And for context, in what year, like obviously there's been a love of plants for a long time, as you've just indicated. At what point did that love of plants then come into, when did cannabis become part of that? Because obviously you're from California, one of the earliest markets in the world. So a wealth of information is coming here. So yeah, can you just talk to that a little bit more so the audience get an indication of how long this has been for you?
So I was originally from Texas.
Okay.
And that's where I was practicing midwifery. So yeah, there was no access to cannabis there. I went back to school and got a horticulture degree, and remember a fellow student asking me, how could I maybe study cannabis? And I said, I have no idea. I guess you'd want to find a professor somewhere that's doing it.
Yes.
And it wasn't something I aspired to, but when I went to naturopathic medical school, that was in the year 2000 or 2003 when I graduated and went to medical school. I actually found this professor at UCSD, at University of Washington in Seattle, that was studying the endocannabinoid system.
Okay.
And so that was kind of my introduction into cannabis, because we did have plant cannabinoids also in the lab, but I was actually at that time looking at inflammation markers in brain tumors.
Wow.
And so, cannabis or the endocannabinoid system wasn't really on my radar. But through the process of going to work in Dr. Stella's lab, this is how I got immersed into the pharmacology of cannabinoids.
Okay.
In 2010 in Washington State, naturopathic doctors were added on as providers who could recommend or authorize medical cannabis. And nobody really knew anything about that. And because I was working in this lab and I was, a clinician, I started getting tapped to train other care providers about cannabis as a medicine. And so then, rather than them taking on these patients, they just started referring them to me. So I've been working with cannabis medically since about 2010, and then subsequently moved to California.
Yeah, wow, wealth of information. I listened to something yesterday. It was on another podcast, and I'm going to pull it up here for the audience. And basically, what it says, and I'm going to come back to the significance of this. It is that a lot of the knowledge in the world has been written. You just got to find the right books. Yeah. So with the context of that, we're in a global space. A lot of the audience that are listening to you right now are from Australia, from other emerging markets where cannabis is still very early in some ways, right? So we're still on the cusp of understanding how cannabis can come into an individual's lives, how cannabis can come into an individual's healthcare, either for preventative measures in terms of reducing inflammation and supporting an individual to get to that state of homeostasis, or as a treatment approach. So having the opportunity for them to be able to tap into your wisdom that you're going to share with us today, and there's going to be bites of that which come through, but basically it is long-winded. We've got a book, that we've been able to support you with, but your wisdom has gone into this book, right? And what's going to be great is to show us what that book is, and we're going to go into that. But in many ways, this is a combination of all your years of clinical experience of working with a number of different people. What triggered you? What was that moment where you thought, a book is needed? Like, what was that process like for you? Like, why did you create this book?
I think that you're correct in, an observation that it's sort of like a culmination of everything I've done across my
Yes.
career. Uh, Caring for women first as a midwife and
Yes.
well woman care, and then, becoming a doctor, doing the research. And then I think I get sort of frustrated with what I call in the book urban legends around cannabis, that may or may not be really supported by what we actually know about cannabis or what's been revealed through, formal study.
Mm-hmm.
And because of, differences between men and women, our innate biology being so different, and we're entirely different creatures.
Mm-hmm.
And there was data suggesting how women respond to cannabis
Mm-hmm.
is maybe different from how men may respond. So,
Yes. And at a high level, can you touch on a few maybe teaser points for the women that are listening to this? A lot of our audience are women, and we see the statistics in the US and increasingly in other areas where women are coming to cannabis as a treatment approach. So what are some high level teaser points that you think could speak to some of the women that are listening to this at the moment? What would you like them to know as a little bit of a lead up to what they can expect if they start reading your book?
well, I think first an understanding of how this endocannabinoid system functions in our body. Um, and for women, one way that we are so very different is our monthly fluctuation of hormones.
Mm-hmm.
And it's been documented that at the time a woman ovulates, uh, levels of anandamide, one of our first endocannabinoids named and discovered,
Mm-hmm.
rises. And so if you think about that endocannabinoid tone sort of going up, and the anandamide, binding receptors,
Mm-hmm.
then, there's this potential competition for THC. And so that women may, at certain times of the cycle,
Mm.
be more or less tolerant to the
Mm-hmm.
effects of THC.
Yeah, wow. Very interesting. Very
Yeah.
interesting.
And then the other thing is, uh, there don't appear to be direct effects of THC on the expression of female hormones, but that scenario could change depending on, how heavy the use is, the potency of the use, because we know that it has the potential to reduce the level of the signaling compounds telling the ovaries to make our hormones.
Mm-hmm.
And so especially for women who may, for some reason, be susceptible to infertility, very high potency and, high cannabis use may be impacting fertility.
Okay. Okay. And then it becomes if you've got a woman that has a number of different compounding concerns in her health, and then she is utilizing cannabis at relatively high doses to potentially offset pain or a whole range of different complications that occur for something like endometriosis, which we know affects many women. some of that messaging, I think, is very difficult for them to be able to obtain.
Mm-hmm.
Because if we have a look at these emerging markets around the world, or we have a look at America, for example, and please talk to this more than me, but we still see in America it's a Schedule 1. There's talk that it's coming down to a Schedule 3. We have a look at emerging markets around the world. There are some brilliant physicians. There are some brilliant cannabis doctors, but we also know there's cannabis doctors that just write. There's doctors that are just writing scripts. There's not potentially a lot of data collection, real world data collection, which goes along with the polypharmacy that occurs, right? So there could be multiple cannabis products that are used, multiple routes of administration, little to no information or research guiding some of that prescription of medicines and prescriptions of medicines that we're again starting to go, well, what is truth? Right. And like, as you mentioned, and we didn't double tap into it enough, but there's a lot of conceptions, misconceptions out there around cannabis and its applications, and some of the research which is still needing to grow. And basically what I'm saying is that we've got increasing awareness of cannabis and the medical utility of cannabis and how it can come into a whole range of different people across the lifespan, particularly for people above 75 plus, as you've as we've had a little chat about before this, and then increasingly in pediatrics as well, and across that whole lifespan. But also at the same time, if there's a lack of information to be able to support patients in their experiences, where can they go to? And at the moment, I think they're going to Reddit, they're going to Instagram, and they're learning from other patient experiences, which always have a bias towards them, which then opens up the opportunity for someone that's been in the field for as long as there probably is, who's then be able to put all that wisdom into a book, which is then packaged up for individuals. So it's wonderful to be talking to you and sharing some of this with our audience.
Well, I think you touched on, something important, which is women's health issues. And,
Yes.
if we looked across different areas, so, the title of the book is Eat, Sleep, Relax, Protect, Forget. And so in the book, I go into detail in each section of how these areas are specific to women's health. So for instance, women have more irritable bowel problems. Women have more autoimmune disease. Women have more sleep disorders. Women are more subject to anxiety and depression. And pain. So we've got this monthly menstrual thing going on, which can come with all kinds of complications, heavy bleeding, extremely painful and debilitating periods, endometriosis, as you said. And so the need for pain benefit is clear for women, right? But I think what's emerging, and we have a very strong foundation in the preclinical literature. So that means if we're studying cells in culture or tissues or animal models of something, that there are biphasic effects of cannabinoids. And we've demonstrated this at UCSD, where I work, in pain, that if we're using a low potency cannabis, vaporized dry herb cannabis for pain, there is a pain benefit that occurs, but as you continue to go up in the dose, that pain benefit is lost. And the same can also be said for anxiety.
So can you just talk to that a little bit more? Because I think there's probably some great misconceptions out there around that, correct? And in many,
because I mean, if you think of our, most commonly used potent pain medication, opioids, we know that people develop tolerance, and so they have to keep going up in the dose, right?
Yes.
And the nice thing that's been demonstrated about cannabis through the pharmaceutical product Sativex in patients with multiple sclerosis was that once they found a dose that was effective for them, they did not have to keep escalating the dose. So I think there's a misconception that more THC is always going to be better.
Correct.
But ask the people who ever had a paranoia experience,
Mm-hmm.
or, extreme anxiety after taking one inhalation of some, 30% THC cannabis,
Yes.
and they'll beg to differ that more is better, right?
Yes. Yes.
And so I think this is something that women may not be aware of, that they may be
Yeah.
coping with their depression or
Yep.
their anxiety by
Correct.
using cannabis, but it's not really treating an underlying cause. And in the
Mm-hmm.
long term, it could be worsening those situations.
Yeah, number of things to tap on. One is we know these things don't happen in isolation, right? So if we know an individual is in pain, then we've got to look at the likelihood of then depression, anxiety coming along for a bit of a ride, right? And so if we know that these symptoms are being presented simultaneously, then what is the impact or the risk on an autoimmune disease? What is then the risk of if we see an individual, a woman at the moment who is in pain, whether or not we're including the monthly flow to that as well, but there's a number of different factors that occur. So what is that level of inflammation that's occurring for the individual at that time? And typically there's a bit of I would say that there is that the recreational beliefs that come into this, which is just consume more and go for those high potency strains, which we know are predominantly in the market, and a lot of the cannabis providers are pushing that. We do start to see a little bit of a narrative change. We spoke about it last week, and I saw a doctor also mention it this week, which is helpful to see that we are getting to the change. But these things don't happen in isolation, which comes back to the need of a holistic approach, right? Where it's not just cannabis as the treatment, but there's other things that your book speaks to as well.
Yeah, and thinking of treating the whole person and
Correct.
looking at root causes, you know, often where it takes me with a patient is back to their beginnings,
Yes.
and, you know, what was going on with their mother when their
Mm.
mother was pregnant with them. And it's amazing to hear how many stories of trauma were maybe occurring, while they were in the womb. And
Yes.
we know now that through the process of epigenetics,
Mm-hmm.
this sets us up biochemically
Mm-hmm.
and also neurobiologically. Our brain can
Mm.
be starting to be programmed even when we're in the womb to come out with this pro-anxiety phenotype. And then you come out into the world, and maybe you
Yes.
were born into a situation which,
Mm-hmm.
it could be anything. It could have just been something going on in the home. It could be larger social issues that impacted you as a child,
Mm.
that are adverse childhood experiences. And so I score people for this and then educate on these effects on our body, and
Mm.
how both emotionally, mentally, physically, biochemically, we have been pre-programmed perhaps
Yep.
for disease later in
Mm.
life, or
Yes.
the PTSD from the trauma maybe incurred in childhood. And so addressing these underlying causes and how the endocannabinoid system fits into
Mm.
that. It's a big part of our stress resilience system, and hammering that system with high dose THC really only suppresses it. And so what the book talks about is how to go about toning this system and
Mm.
bringing things back into balance by addressing the whole person.
Wow. And I don't think we can underestimate how profound it is what you just mentioned in terms of if an individual or a family or a couple are at the moment exploring pregnancy and wanting to bring a child into the world, pausing and thinking about the significance of what you've just mentioned in terms of what is happening for that child in the womb and what is preparing them for when they enter the world, and what is that environment like. And I know there's, it's not to meant that statement isn't meant to place more stress or to overwhelm individuals along that journey, because we know that there can be a whole range of complications, but it probably marks the significance of that life-changing moment occurring for parents from the very beginning, correct? Because it's all about nurturing at that stage to be able to set them up for later in life. Thank you so much for highlighting that.
Yeah, it's all about being conscious, right? I mean, I have to say,
Yeah.
I went into parenthood extremely unconsciously. And,
Yes.
and how many of us have done that? Because
Mm-hmm.
who was there to really prepare us?
Yes, yes, yes,
Not
yes.
our own parents. They didn't really know that much
Times were
about
different.
parenting either. So, you
Mm-hmm.
know, I see a real encouraging movement of, being more conscious about these things in the world. And
Yeah.
that's very encouraging.
In terms of consciousness, because it's not such a small topic to just to go and face. But if we're to take something which could be a little bit more accessible for individuals, and it would be in terms of potential general well-being and clarity in their cognitive health, their mental health, and where they are, how does an approach that an approach that includes some cannabis into that, how does that then optimize them potentially to then get these awakenings and more conscious, more living, mindfulness? How does that all flow together? How can you speak to that?
Well, I think, if we go back to the eat, sleep, relax, protect, forget,
Mm-hmm.
building the foundations of health. So, an important first topic that I speak to with patients is sleep. And
Yes.
really drilling down into, not just how many hours did you sleep, but what's everything around sleep for this
Mm.
person? How easy is it to get into sleep?
Mm-hmm.
Is there a lot of wakefulness? Are they having
Yes.
sleep disruptions? Are they snoring? Do they have
Mm.
apnea?
Mm-hmm.
Because if we don't have adequate restorative sleep, it
Mm.
affects every aspect of our life. And so cannabis can be a great tool to help that. But
Yes.
again, there appear to be these biphasic effects, because I
Mm.
think what people will hear a lot is, just like alcohol, cannabis is going to disturb and disrupt your sleep.
Yes.
I don't think that's necessarily true. The early studies were a very high dose of THC, like 35 to 150 milligrams. And the very small literature of low dose THC at night for sleep actually showed a strengthening of what we call the ultradian rhythm,
Mm-hmm.
going in and out of deep restorative sleep and into REM
Yes.
sleep. So, there's ways to tone the system
Yes.
using cannabis. There's ways to hack it, and then there's
Mm-hmm.
ways to suppress it.
Yes. Yes.
And bringing all of this into, cannabis as a medicine is really important.
100%. Just one point. I like to, when I've spoken to other researchers, I like to just ensure that everyone can you just speak to what the biphasic effects mean, just for an individual out there that may, because I know you've mentioned it on 2 occasions. Can you just speak to that a little bit more, please?
Well, let's see, how would the best way to describe it? Because pharmacologically, there's several different ways to look at it.
Mm-hmm.
So one way to look at it is that at low dose, you can have one effect, and at high dose, you can have an opposite effect.
Mm-hmm.
And that's primarily what I'm saying when I
Yes.
say biphasic, because this is pretty well documented for THC dose and anxiety,
Mm-hmm.
that
Yes.
at low dose THC, it's just inhibiting the cannabinoid receptors at excitatory synapses in the brain. So it's just
Mm-hmm.
kind of like slowing things down,
Mm-hmm.
calming things down.
Yes.
You go a little bit higher in the dose and you start facilitating dopamine and serotonin, and then comes the more euphoria. And
Yes.
then you go up higher in dose and you inhibit the cannabinoid receptors that are at the GABAergic, or GABA is our very calming. And then you're inhibiting inhibition.
Mm.
You're slowing down the GABA currents, and we don't necessarily want that. That's where the paranoia and
Yes.
the anxiety comes in. And so that's kind of a biphasic effect there, that you've got,
Mm-hmm.
reduction of anxiety at very low dose
Yes.
and causing anxiety at high dose.
And that low dose THC option also could be a full spectrum CBD, correct?
Yeah,
Yeah.
yeah, that's one of that's probably the easiest way to get that dose, because at
Yes.
that dose, hopefully we're like upregulating the receptors.
Mm-hmm.
If our own endocannabinoid production has been suppressed for some
Mm-hmm.
reason, our receptors will tend to get downregulated. And so this is how we interact with plants in the world. They
Yes.
provide biological compounds that
Mm-hmm.
are not nutrition for us. They're not carbohydrate
Yes.
protein. We're not growing by taking them in, but they are affecting our biochemistry. And so a low dose is there as an intention to upregulate a
Yes.
system.
And that full spectrum CBD, again, if people are joining in and they don't know, the isolate CBD is just CBD, whereas the full spectrum has small amounts of THC and other cannabinoids along with the CBD. And as you're mentioning, for something like indication, and we went into this last week actually, you would speak to this better than I would, but yeah, in terms of that full spectrum CBD as a potential option for anxiety, it's exactly as you have spoken about and outlined there. But that would also potentially mean that people could be microdosing or low dosing on a THC option as well. And it made me think just before and it's to give OnTracka a bit of a plug, which is one of the doctors that we have worked with in the past. What he said was that what he found by using this dosing titration tool that we have is that it helps patients to get optimal release with the least amount of medicine. And that's very different to culture in some ways,
Yeah.
because culture is how much can you take, how many different flowers and strains can you do, and how much hopping can you do from flower to flower to flower to flower or to products. Whereas it's like, what is the outcome, right? What is the outcome, and how can you mindfully integrate this medicine into your life, whether it's for prevention, whether it's for treatment, or whether it's for maintenance?
Yeah, I think the one term that you did not use is broad spectrum.
Correct.
So, and so that will typically be a hemp extract from which the THC's been removed, but there could be some other minor cannabinoids there, right?
Correct. Yes. Yes.
And I'm an advocate of THC because it's the molecule that's directly activating the cannabinoid receptors. Much more potently than any of the minor cannabinoids
Yes.
have been reported to do. And CBD is not activating those receptors. So I think there's a lot of misconception about CBD
Yes.
and its action on the endocannabinoid system. And, the data is really not in. So far, CBD in people
Yes.
hasn't been shown to even elevate anandamide levels. So,
Yes. What I
and
was
I
just going
think
to
that that's the claim is you're modulating your endocannabinoid system by taking CBD, but there's not good proof of that yet.
very good preclinical, right? But then when it doesn't necessarily always translate into how humans interact with it.
Well, I think that all came from one paper or there were two papers on patients in schizophrenia,
Yeah. Okay. Yes, I've read
where
that. Yeah.
they were giving extremely high dose,
High
up to
doses.
100 milligrams,
Mm-hmm.
and saying that it elevated anandamide levels. Well, if you look back to their previous paper, people with schizophrenia already had elevated anandamide
Mm-hmm.
levels. And then they did the experiment in cell culture showing that CBD was inhibiting FAAH, which degrades anandamide. But this has not yet been demonstrated in humans. In fact, I know there's one negative demonstration of this. So
Yeah.
yeah.
Good.
Yeah, I mean,
Good
we
to
have to
hear.
really sort through the claims being made by the industry.
Yes.
And, that's what's challenging for people. And I think this is why they need informed, medical providers and the ability to trust these providers that they know what they're talking about.
Well, it's very evident of your knowledge, and I know a mutual connection of us. Lee introduced us together, and from the beginning, there's always, your knowledge has always been able to shine through. And I know that people listening to this are already seeing some of that, and we're going to tell everyone very soon about how they can access your book and find out a little bit more about you, and to be able to get your wisdom to support them in their journey wherever they are. And one point that I would like to touch on at the end is that whole idea of mindfully consuming medicine. And I think we touched on a little bit of consciousness just before, but we didn't get into it in a whole lot of detail. But at times when there's so much information that's available, right? And whether it's bite-sized TikTok videos, whether it's Instagram Reels, whether it's tweets, whether it's longer form YouTube, so much content that's continuously being consumed. And then for an audience that is reading as well, there's that whole process and the difference between potentially when you're at university or you're in college and you're reading and then you're needing to kind of like download that information to ensure you're not skipping forward. One of the big exciting things that we're talking about and launching today is alongside your book, there's a companion app which goes in and gets triggered at certain pages, which obviously with his OnTracka. Can you say like why is this because it is world breaking, so we're so happy to be part of this. But from your perspective, what do you see the benefits of this, and why would this be important for someone that's reading your book to then be able to say and check in at each stage with the questions you've designed, which then we've incorporated into a custom mobile experience? Can you talk to that a little bit, please?
Well, I think thank you, for
Yes,
supporting the book and
of course.
creating this platform for readers to make the book an interactive experience. So I think I don't know if I've ever seen a book connected to an app or not, but
Mm-hmm.
it was an idea I had that I thought people seem to like workbooks,
Yes,
and to be like given things to do rather than just sit and read, and so this enables people to score themselves for something, try the suggestions in the book, come back, score
yes,
themselves later to really see if there's progress or not. Because, sometimes it's a trial and error process, right?
yes, yes, of
With
course, right?
cannabis, but
Yes.
also, we're all different creatures. We don't all
Correct.
respond equally to the same drugs or herbs
Yes,
or supplements or lifestyle changes. So it's a
100%.
process of becoming intimate with ourselves,
Yeah,
you know,
yeah,
and
yeah.
and that's what I'm hoping for with, using OnTracka along with the book, is that people will come to know themselves at a deeper level,
Yes.
and this is what it takes to really bring change into one's life.
Yeah, no
That
doubt. No doubt. It's
willingness to know oneself and become intimate and have compassion for what's happened to me.
yes, yes. And
And how can I work with this to promote my optimal health moving forward?
yeah, and that key point from surviving to thriving, right? So how do we support more women to thrive? And it's what
Yeah.
greater
How many
mission
women
can
are
there
just
be?
trying to survive every day?
Yeah,
It's hard.
yeah.
There's a
Well,
lot of
it's
social pressures, family pressures, pressure we put on ourselves, to
mhm.
perform and be the best and do it all. And do we
Yes.
really have to do that?
Yeah. And throughout all that, how then do you come back to that homeostasis? Because if you don't, what are the risks or the likelihood of depression, anxiety, whole
Yeah.
range of other complications that come with that as well?
Yeah, because I think often, how women are functioning in their world in adulthood is a direct consequence of how they learned to adapt
Mm,
in a situation which, now taken into a different situation in older life, is potentially maladaptive. But it's like a rut in the brain. You trained your brain to do
mm.
this, and now it's time to retrain the brain.
Love it. With that, we have links that are coming up across the screen at the moment. Also, click down wherever you are for access. We've got a whole range of links where you'll be able to purchase the book. You'll be able to learn much more about this and get your own confidence that this is the place to be able to support your journey, support you to switch from surviving to thriving. After you purchase the book, as mentioned, there is a custom OnTracka version which supports you at each chapter, and that'll be able to support you on that journey. There's a custom experience that we've designed, and it's an absolute honor to be supporting the crucial work that you're doing in the community. So from us to you, thank you very much.
Yes, and thank you. And I want to mention, because I know you and I have talked about this, and it's something I'm out in the world, exploring, is the potential to partner with organizations that are producing products for women's health, because they can tap into this
Yes.
network and, we can actually do a formal prospective trial
Correct.
with the audience of the book
Yes.
and give these manufacturers or producers of products real world data
Yes.
on how their product is actually working in women's health.
Yes. And obviously be guided by the ethics of a researcher like yourself. So all anonymous, no information that can identify an individual, etc., with the highest standards that individuals can expect from OnTracka is applied into that. So I just wanted to make mention of that. There's been, when you have a look at this, I know in today's world, because of what's happened in the past with Amazon, Facebook, and some of the creepiness, some people have privacy concerns. And the collaboration and that potential for research, I know what we've spoken about is patient privacy. So I just always want to be able to mention and highlight the importance of that anything that will be done, if there is prospective research being collected, it is all anonymous and done with the highest standards.
And I think also, it would serve to mention the care that you've taken in developing the platform to use validated research tools, right? We're
Correct.
not just making up these questionnaires. These are questionnaires that are
Yes.
used by researchers the world over, and they're
Yes.
highly respected in terms of what they're asking and what we're learning from them.
Yeah. Yeah. And I think the audience and being able to group together what is occurring, the changes that we're noticing is going to produce some very interesting data. So from our side to yours, thank you very much. If anyone wants to follow up, again, there's going to be information where you can continue to get your own certainty about this being an option to support your health and well-being.
Thanks for having me. And thank you so much for working together to make this a reality with my book.
Of course. We're big supporters. Thank you very much. I'm just going to stop recording right